Mm-hmm.
and it is the way by which psychiatrists diagnose
Mm-hmm.
mental disorders. And the most recent one is the DSM-5, and there's a whole set of criteria in there, and that's how you diagnose PTSD.
Oh, okay. So it's like a rule book basically.
So it's a standardized book.
Mm-hmm.
So it's standardized symptoms, and it's revised every so often, every couple of, it can go 10 years in between manuals and whatnot. So it's sort of a constantly changing, evolving thing. But that is the standard by which we pretty much all mental health professionals diagnose PTSD.
Oh. And is there a way to prevent it?
Not that we know of. There's been a lot of research that's gone into figuring out why some people go through trauma and don't develop PTSD, and some people do go through trauma and develop PTSD. There's a concept called resilience that people are trying to do research in terms of like a protective factor for people.
Mm-hmm.
But at this time, there's no clear way, like there's not really a preventive health approach to PTSD.
And is there a way to cure it?
Well, that's a tricky question. Just like any mental disorder, you can't really say that there's a cure.
Mm-hmm.
Saying that there's a cure means like it's like a bacterial infection and you take antibiotics and it's gone. It's not like that.
Yeah.
But there are lots of ways to treat it.
Oh, okay. So like talking about it definitely helps.
Yeah, so therapy can be helpful. I'm sorry, we're going back to the prevention. I mean, there's been also some methods, particularly in the military, where they've tried to figure out ways to debrief people who are in combat or who have been through trauma, so that there's less chance that they'll develop PTSD, but that's not really, it's sort of like intervention to try to help support people
Mm-hmm.
right after trauma, but it's not like a foolproof way of preventing it.
Oh, okay.
But yeah, there are many different ways to treat PTSD, including therapy and some medications, and there's lots of different types of therapy that are used.
Is there like a certain way that anxiety or stress like affects the brain?
That's a really broad question. Yes, anxiety and stress affects the whole body and the brain in different ways. So we think that anxiety disorders or post-traumatic stress disorder, disorders that come from like a major trauma or stress, they have certain like neurochemical changes that happen in the brain as a result of it. But it's pretty complex. Like it can change the hormonal balance for people, like where your cortisol level goes up, and that affects your whole hormonal balance.
Mm-hmm.
So it's pretty. Yeah, so it's like it's measurable effects on the brain in terms of like what the structure looks like, but a lot of it is also, it's not like we do a brain scan and can see for sure.
You said about the hormones and neurochemicals. Do you think that based on your gender, if that would make a difference? Because I know hormonal levels are different for a male and a female.
Yeah, so it's not as if, so it's not, sorry, I was getting a call. So it's not as if, I don't know of any research specifically that talks about how anxiety or stress, affects men or women differently. I mean, obviously, women have, just like you said, like women have different sort of hormonal balances,
Mm-hmm.
and that in and of itself can be a stressor, like just going through your menstrual cycle and like periods of hormonal change, like pregnancy or menopause, are high-risk periods for mental illness. It's for women. So yeah, there are some gender differences.
Okay. If I think that someone is like experiencing like post-traumatic stress disorder symptoms, what should I do?
Well, I think that it kind of depends on who it is, right?
Mm-hmm.
So it's kind of the same questions that you would ask like if you think someone's depressed,
Mm-hmm.
or if they're dealing with anxiety, or if they're going through some sort of stress. It all depends on kind of like who they are to you and what the best approach would be. It's like on an individual basis.
Oh,
So,
okay.
if someone who's close to you, you can ask them about it and talk to them about it and encourage them to seek help. If it's someone that you don't really know very well, that's a little more tricky, right? Because you don't want to get into the realm of sort of diagnosing people from afar, which we do all the time in the media.
Yeah.
You can, like, commentators will say, like, oh, this person has this mental illness or that mental illness, but, no one really knows apart from that person, and hopefully they have some good providers around them, like, professionals who are able to help them with whatever they're dealing with. So I think the answer to, what do you do, it depends on on how close you are to that person, like who they are in your circle. But I think the general rules are like, asking open-ended questions, providing support and empathy. Those are all good things regardless of who they are, right?
Yeah. And do you think that having this illness makes you dangerous to society?
No, absolutely not. Yeah, that's a huge misconception that mental illness somehow makes people more violent or makes them more dangerous, and that is not the case. And it contributes to stigma. So that's pretty important to emphasize, that it doesn't make people dangerous.
What do you think that they're dangerous for them to themselves?
Well, they can be. That's part of that can be a symptom of mental illness. Suicidal thoughts, so they can be a danger to themselves. But a lot of people who try to commit suicide or commit suicide may not have ever been diagnosed with a mental illness. So it's a tough thing.
I feel like it's hard for them to for some people to admit that they might be going through something like this.
Yeah, that's a big thing. Yeah, I think it's because there's so much stigma, right? Meaning, there's so much prejudice against particular diagnoses or people saying that they're mentally ill, and it's a really prevalent thing. Like, a lot of people suffer from mental illness. Like 1 in 5 people will have depression throughout their lifetime. It's a really common thing, but a lot of times, because we sort of the stereotype or like the stigma is that mental illness is somehow associated with weakness, or that it's a failure of, like it's like a character flaw. I think that discourages a lot of people from coming forward.
Do you know of any certain situations that would cause PTSD, or is it just something broad depending on a person?
Yeah, so if you, again, going back to the diagnostic manual, right, I mean, it does depend on the person, but generally we think that situations where you feel as if your life is in danger, so like a life-threatening kind of situation, or if you've witnessed or seen other people, like people that you're close to, going through a life-threatening situation, that could be the source of trauma, but it is, that's really broad, right?
So it doesn't necessarily have to happen to you?
No, yeah, it can happen if you've witnessed it happen to someone close to you.
And do you know of any research that's being done right now, besides you said in the military, to prevent this disorder?
Oh, I'm sure.
And do you think that there needs to be... Do you think that there should be more research done, that we need to focus on this disorder and help these people, or that where we're at right now they have enough help?
find anyone who says that they have enough help. You know, there's a huge gap in terms of making mental health available in our society, around the world. You know, it's a major health disparity when it comes to providing like adequate mental health care to everybody. It's a problem like here in California. It's a problem, you know, internationally. So yeah, there should be a lot more research done and you know, funds spent on prevention and things like this. I don't think there's anyone who would argue with that.
Okay. That sums up all my questions. Thank you so much